Good morning, good afternoon, good evening, depending on what time of the day you're watching this video. I am Kintu Timothy, one of the members of the Secretariat of the Patient-Centered Care Movement Africa that is moving towards engaging all health professional students on the continent towards a more patient-centered care approach in the care of their patients. Important in this care is ensuring that we have an interdisciplinary team approach. Why this is important is that as we move on, diseases are getting a lot more complex. And patients these days come in with multiple morbidities, and that simply means that one healthcare professional alone cannot take care of a patient as it was in the past. And albeit, these days there are a lot more healthcare professionals. Therefore, it is important that we move away from a fragmented system. An example being here, where I study from in Uganda. Most times you'll find that if I have a condition, maybe I have hypertension, I will go to my general practitioner, explain to him what is wrong, he'll give me medication for that, and then if I have renal disease, I'll go to a nephrologist who will treat me separately, possibly send me to the lab, I'll meet a medical lab scientist who will give me their own treatment, and at any point during that treatment, if I get admitted, it will be a nurse taking care of me. Now what this means is that the patient's needs, values, and preferences cannot be taken care of in such a fragmented system because one, each healthcare professional involved in this system will tend to think that the other has done so. This is why it is important that we move towards an interdisciplinary approach, especially as the future healthcare professionals, as the healthcare professional students in Africa. It is very important because one, when the patient is jointly assessed by the whole team to make sure that the team understands where the patient is coming from. At least someone on the team will take time to understand the patient's cultural background and take a deeper understanding of the patient's needs and preferences. There will be better communication in the team, and what this means at the end of the day is that I will be more satisfied as a patient. I will much more likely to have a better quality of life and better likely to have outcomes that are of interest to me and my family. This is why an interdisciplinary approach to patient-centered care is very important. I encourage all of you students to join us, to join this movement as we look forward to creating a new wave of healthcare professionals that always take into consideration where the patients are coming from, what their patients actually want, and take time to have a conversation with their patients. We can only do this when we have a more interdisciplinary approach. Thank you very much.